This is Alison. She's one of our patients that we saw about 6 months ago, and we were recently completing some of her last dental work, biologic dental work. We took out another mercury filling for her, but she had an interesting story that she wanted to share with us about the root canal that we took out in December of last year, tooth number 3. So, Alison, if you wouldn't mind just sharing your story with us, we appreciate it.
Sure. I had the root canal removed last December, and immediately after my root canal was removed, my lower back pain went away. And I had the lower back pain for years. I've been seeing a chiropractor. I assumed it had to do with being at work and sitting all day long, and I don't have those problems anymore. In fact, I was saying I was in a 4-hour meeting this past week, and I can sit for hours, and it's not a problem at all.
So what's interesting too is this: we're talking 6 months later. You know that is it going to last, or is it going to hold? And you've had no
I've had no
symptoms, any symptoms showing up since that with the back, right?
And it was immediate. The day I went home after my root canal, I had to sit for a while because of the drainage, and normally that would be a problem. And I noticed it right away that the back pain was gone, and I've not had a problem since.
Have you been to your chiropractor since? I mean, have you seen
once?
them,
Because I haven't really needed. I haven't needed to go to a chiropractor.
And he was like scratching his head, or did he understand what was going on? Or
well, I didn't really relate the two actually until I came back and you were talking about the tooth that I have being related to my back pain. So I haven't seen him, and I'll mention it to him, but I really don't need to go back to the chiropractor.
It's kind of funny. Right behind you is that tooth organ chart that I was just showing you before we started this video, and it shows how tooth number 3 lines up with lower back, and that's where the problem was in the lower back, right?
For years. I mean, I can't even tell you how many years. And like I said, most people just assume it's because I'm sedentary. I mean, I work in a job where I'm sitting all day, and had to get a standing desk, had to do things to try to relieve the pain that I had, not recognizing that it was directly related to this particular.
Well, hopefully as we keep seeing you over the years for cleans and things like that, we'll keep track of this too, because sometimes we talk about this being the honeymoon phase where, it feels good for the first month or two, or, and then it comes back. But I mean, we're already out 6 months. I'd like to see what happens in another 6 months from now, a year from now down the road. But for right now, you're pain-free there, and thank you for the interview.
Not a problem.
All right, thank you.